In this case study, we're looking at fibromyalgia, one of the most challenging chronic pain patterns we see in practice. I'll break down why these patients struggle to heal, how autonomic imbalance and sleep dysfunction drive the condition, and what I'm looking for during treatment to know right away that we're making progress. This will help you build confidence in complex cases, even when results aren't immediate.
So because of the fibromyalgia, I took your advice from an earlier training and tried to do a lot of SI-16 with TENS pads with a voltage over 28 without resistors, bilateral, to try to just get some parasympathetic tone in place, ease up the sympathetic lockup, and to reduce the damage from what would otherwise be fairly innocent needle placement. I've also done a lot of right liver area, ear area, some histamine points on the non-dominant side. And I think, it's the frustrating thing for me is that the fabric of what we're doing makes a lot of sense to me, but I don't get a sense that sometimes I make a difference in a treatment, sometimes I don't. And I think it's just a matter of hanging in there and persisting because, as you point out, chronic issues aren't going to be dispelled in 3 treatments. They need more like 30. But it is challenging to not have the level of confidence that you have and to have one episode really not make a difference. And then the next episode, you might make a temporary difference. So just,
Gotcha.
yeah. So
Yeah. So there's a lot going on here. Fibromyalgia. So let's focus for your case study on fibromyalgia. I think that'll help you more. Fibromyalgia, we said, is fiber muscle pain. And you made some very good points. You said that you want to minimize damage from needles. Fibromyalgia patients, a lot of times, are never dropping into deep parasympathetic mode, so that even the minor micro trauma from a needle is never really allowed to heal. Well, so in that case, one is make sure they have Gucci to be able to do the things and create the molecules and the cells that the patient needs. So multivitamin covers a lot of bases. Usually iodine is necessary and deficient. I don't know where you live, Frederick. Where do you live?
in Boston. So,
Okay. So
yeah.
United States, many of our patients are deficient in iodine. I don't know if your patient's having iodine. The other tricky thing is getting them into deep sleep. And caffeine has a 6-hour half-life. So if the patient drinks a 16-ounce coffee in the morning, then at, let's say, 8 a.m., they drink 16 ounces of caffeinated coffee. By 8 p.m., there is still a quarter of the caffeine floating around in the system.
Luckily, that's not one of her vices, but would you
Thank
comment?
goodness.
Would you comment on the left versus right stomach 36? Isn't it the left
Yes.
is the barbiturate point and the right is the caffeine point?
I will look that up in a second because I actually forgot. But the caffeine thing, the patients can fall asleep, but they won't drop into deep sleep, rest and recovery. So that's one thing to take into account. Back to the stomach 36 thing. Let's look it up here.
We may have to go to strip monitor to get it.
Yeah, I think you're right. Let's go to strip monitor.
There was a barbiturate analog. If you scroll up a little bit, we just went past it somewhere. Oh,
Okay, let's see. Caffeine analog is the right side.
okay.
and
So this could
barbiturates to
be
the left
this could
side.
be ideal. Would it make sense then to do right LI4 to left stomach 36? So
I like that a
you're
lot.
doing a crossover and you're nailing the barbiturate. But here's the thing. I cannot find where stomach 36 is on the ear. Even strip mount doesn't show it. It drives me
Okay.
nuts.
I'll show you in 1 second. And then you can use that as category 1 tissue point, right? The
Which,
LI4,
oh
the
yeah,
stomach 36. And then you said link it over to LI4. So there's your category 4. So you still have 2 points to choose. And then on the ear, stomach 36. So here's how I find it. This are
oh,
like,
it's in auriculo?
yes,
Oh,
except it's even wrong in auriculo.
oh.
So it's in the groove,
Is it in
right
the
where my,
deepest part of the pocket?
yes,
Okay.
it's on this lip here, half on the lip and half on this other surface.
Okay.
Yep. I usually follow this line here.
Point zero?
Yes, or like this anatomy. I don't know what the heck you call this.
It's the
So like this curves around and
it's
then
the
comes on the
interconchal
ear.
ridge, I think.
So this thing I follow out to the groove and then I go and check above the groove, in the groove, but above.
Okay.
Yeah.
Neat.
Cool. Back to fibromyalgia, we said make sure you cover the Gucci, make sure you get them sleeping, and make sure you fix their parasympathetic nervous system.
And are you fixing the sleeping through the parasympathetic nervous system? How are you? I mean, I know there's
Yeah.
insomnia protocols
So
in the ear, but
If you're working with chronic pain or fibromyalgia patients and you're not seeing consistent results, sleep is often the missing piece. I've put together a free resource below that shows you the most effective acupuncture point for restoring deep, restorative sleep, so the nervous system can actually shift into repair mode. If you want to implement this right away, click the link below to download the free guide on the most effective acupuncture point for restoring deep, restorative sleep. It's a simple place to start when chronic patients aren't recovering the way they should.
yeah, each patient's different. They could have lack of sleep from a parasympathetic, they could have a lack of sleep from a fire channel issue.
that's
Or
tired.
they could,
Is that tired and wired?
yes, or they could have a sleep issue from an earth channel issue because it feeds the frontal lobe of the brain, not creating enough melatonin or neurotransmitters for sleep. Those are the two main insomnia patterns.
I'm sorry, say that again. The two main ones are frontal lobe,
Earth
melatonin,
channel,
Yeah.
earth channel, frontal lobe of the brain, or fire channel related to autonomic nervous system.
Yeah.
And then you said results, right?
Yeah.
So when I put my first point in, I'm looking for a result, not in anything the patient tells me, not in later on when they come back, did the treatment work? That's okay. But I'm looking for some sort of change right away, such as when I first started looking for it, it's intestines start growling, or they take a deep breath, or they fall asleep, or they start sweating, or they fart, or some change right away. If that happens, then I know I've gotten the spot, no matter what the patient tells me, because some of them lie. They don't do it on purpose. Now, when you do that, not even for long, when you do that a while, right now, I notice there's a change in the room. It's tough to describe. But that's the type of change that lets us know the treatment is doing something. they leave your office with the right terrains and tissues charged up, and some leaks have been solved. But on the first, second, third, fourth, fifth, 10th treatment, depending upon how chronic they are, impossible to solve all the leaks. So they're going to drain off again until your next treatment, when you can tackle some more leaks and deficiencies. And yes, you're correct. Severe patients, I usually, in my mind, I want to give them 30 treatments, but to make it a little more digestible, I tell my patient, you're in the severe category. I recommend starting with 20 treatments. And then what I noticed is many of my patients are 70% better on the 20th treatment, and then we can decide to space them out after that. Or if you want to get better than 70%, we can keep going with another 10 treatments close together. Does that help?
It does help. And if any of the other attendees have a thought, I'm all ears.
So if anybody wants to speak, just ask and I will unmute you. Kelly says, can you clarify, right LI4 is a category 1 point tissue? I have it listed on this syllabus here as a category 4 point, right? But you can lump it under a tissue point if you're really treating the thalamus. And Frederick mentioned that if a pain signal goes on long enough, he mentioned in his case study that it creates sort of a type of scar tissue in the thalamus. And you can treat the thalamus as a tissue by needling it directly. Or you can treat it like a global pain point, because LI4 is the same point as thalamus and will release global beta endorphins. Did that help, Kelly? Also, Kelly says, I'm starting to know when a point will be activated before I touch it with the Point Select. That is excellent. And that's what I'm trying to get you all to think about. I know many of you who've been with me for a while already do, but this is just a framework to get you to do the pre-diagnosis before you get to the Point Select to verify your diagnosis electrically.
If this case helped clarify how you think about fibromyalgia and chronic pain, you'll find the free sleep resource linked below to help you apply this in practice right away. And if you want more case-based breakdowns, protocols, and real-world electroacupuncture strategies, make sure to like this video, subscribe to the channel, and turn on notifications so you don't miss future trainings. Thanks for watching, and I'll see you in the next session.